I'm Dr. Yasuhisa Sakata of Saga University, Saga, Japan. I'd like to introduce our paper, High-Density Collagen Patch Prevent Stricture Following Endoscopic Circumferential Submucosal Dissection of the Esophagus, a porcine model. This research was conducted at Med Kobe and Saga University. Dr. Takezawa made high-density collagen patch at National Agriculture and Food Research Organization. Endoscopic submucosal dissection was a standard dissection procedure for gastrointestinal neoplasm. ESD has been used for esophageal squamous cell cancer. A previous report that up to 90% of patients who underwent ESD suffered severe esophageal stricture after extensive endoscopic mucosal dissection. We have not established standard prevention methods to prevent the esophageal stricture after ESD. We devised an easy-to-use Collagen device for reducing the stricture after extensive esophageal ESD. In addition, we demonstrated that the device was capable of promoting epithelialization of the wound area and inhibit inflammation. Periodic injection or oral administration of straight balloon dilation and temporary stent installation are commonly used to prevent postoperative stricture, but these treatments achieve only limited therapeutic effects. Collagen butyl gel is a collagen-based biomaterial consisting of high-density collagen fibers equivalent to connective tissue in vivo that is created by a vitrification process. We previously established an artificial skin based on collagen butyl gel and demonstrated that it can promote epithelialization of regenerative skin and inhibit scar formation and inflammation. The surface of the esophagus and skin is covered by a squamous cell. Considering the histological similarity and biological commonality between the esophageal mucosa and the skin, we developed a collagen butyl gel patch (CBP) as a device to prevent esophageal stricture after extensive ESD. In this study, artificial ulcer in the lower esophagus was prepared by standard ESD technique. CBP was grasped with biopsy forceps and settled onto the artificial ulcer. Each CBP was fastened to the marginal mucosa of the artificial ulcer with hemoclips. Endoscopic examination was performed at day 7 and day 14. The control group showed severe stricture at day 7 and pinhole structure has developed by day 14. In contrast, the CBP group showed mild stricture and better patency of the esophageal lumen. CBP prevents stricture after esophageal circumferential ESD. CBP also promotes mucosal epithelialization and inhibit inflammation and fibrosis after ESD. Regarding the high-density collagen patch appropriate for esophageal mucosal regeneration, Dr. Takezawa and his group fabricated it by utilizing an aterocollagen butyl gel-related technology. Here, the butyl gel is defined as a gel in stable state produced by rehydration after the vitrification of the transitional hydrogel. The aterocollagen butyl gel is generated by 3 processes. You can watch this process on YouTube by using the search keyword butyl gel. In the current study, we used a round-shaped collagen gel membrane prepared by the vitrification of aterocollagen butyl gel membrane as a patch for an artificial esophageal ulcer. The collagen gel membrane is appropriate for the endoscopic banding because it is a dry material with semi-transparency and shape stability, and it immediately converted into the collagen butyl gel membrane through exposure to the wet wound surface. This collagen butyl gel patch possessed excellent biocompatibility. However, its initial adhesion ability toward the wound surface is poor and hemoclip and essential for its fixation. So Dr. Takezawa is now planning to improve the initial adhesion ability of collagen butyl gel patch in the viewpoint of developing a new medical device. We made a pilot study of a new device at present. Regrettably, we did not finish the optimization of the medical configuration. I hope this Collagen patch become a promising first-line medical device for extensive ESD of esophageal cancer. Thank you.